A 62-year-old woman was brought to the emergency room on a Tuesday morning, and the team knows immediately something is terribly wrong. Her blood pressure is dangerously low as 70/50. In case of you and me, it should be 120/80. Her heart is barely pumping. Her oxygen levels are dropping rapidly. She can barely breathe. The monitor screams an emergency rhythm. The electrocardiogram shows the classic signs of something devastating, the dramatic electrical changes that suggest a massive blockage in the main arteries feeding her heart. The emergency protocol activates, oxygen masks were placed, IV lines were put, advanced medications rushed through her veins. The diagnosis seemed obvious. She is having a severe heart attack, possibly the worst kind. Minutes matter. The cardiologist decides to rush her to the catheterization lab, the place where they can thread a tiny camera into her heart vessels and see exactly where the blockage is, then open it up immediately to remove the clot. But what they found inside will shake the entire team because something impossible is about to unfold. Maria is 62 years old. For 35 years, she worked as high school administrator, and everyone who knew her had the same description, the person who had everything together. She managed complex budgets. She mediated between angry parents and struggling teachers. She created orders from chaos. She did it with a calm that made her irreplaceable. She wasn't wealthy or famous, but she was solid. She exercised regularly. She kept her cholesterol in check. She doesn't smoke. She was a widow. Her husband had passed away 80 years ago, but instead of falling apart, she rebuilt her life around what mattered, her children and her work. She had purpose and control. 3 months before this emergency room visit, something remarkable happened. Maria retired. After 35 years of 6 a.m. mornings and endless problems, she finally stepped away. She was going to see her daughter who lived across the country. She was planning to spend the time with her grandchildren. She was finally going to breathe. After menopause, something shifted in female's body. The hormone estrogen, which had been protecting the heart for decades, dropped dramatically. 5 days before the incident, her daughter called. The conversation lasted maybe 2 minutes, but it changed everything. Her youngest grandchild, a 5-year-old boy, had been diagnosed with a rare childhood cancer. The words hit Maria like a physical impact. Suddenly, retirement means nothing. The plan she had carefully constructed dissolved in seconds. All that remained was terror. The kind of fear that doesn't respond to logic or breathing exercises. For 5 days, Maria couldn't sleep. She checked her phone obsessively for updates. She couldn't eat. Her stomach felt tight. Her mind raced with worst-case scenarios. This wasn't anxiety, this was survival instinct in overdrive, activated by something she couldn't fight and couldn't escape. What was actually happening to Maria's body during those 5 days is something neuroscientists have been studying for decades. When a threat is detected, even a threat that is 1,000 miles away, the brain doesn't care. A small region deep in the brainstem called locus coeruleus is activated. This is the body's stress center. It is one of the most ancient parts of the brain connected to survival itself. The moment this region activated, it sends a cascade of signals throughout her body. Her adrenal glands, two small tissues that is sitting on top of her kidneys, receive the signals and did exactly what they are designed to do. They release stress hormones, specifically adrenaline, which is also called as epinephrine, and noradrenaline, which is also called norepinephrine. These are the body's fight or flight chemicals. Normally, when stress hormones are released, they are released in measured amounts in healthy levels, the kind that make your heart beats faster when you are scared or your muscles tense when you are threatened, the kind that help you survive danger. But what was happening to Maria wasn't the normal level. The amount of stress hormones flooding her bloodstream was astronomical. Research shows that when extreme emotional stress triggers this response, catecholamine levels, that is the scientific name for these stress hormones, that can surge 2 to 3 times higher than normal. And here is the critical thing, those stress hormones were heading straight into her heart. By day 4, Maria noticed her heartbeat was irregular. Sometimes it feels like it was racing hundreds of beats per minute, like a hummingbird's wings in her chest. Other times it would skip beats. She was sweating without any physical exertion. The chest pressure was now constant. She knew something was severely wrong. By day 5, she couldn't walk 30 feet without needing to sit down. She felt dizzy when she stood up. She had to grip the furniture to keep her from falling. When the ambulance arrived, Maria was in cardiogenic shock. That's a medical terminology for the heart is so weakened that it cannot pump enough blood to keep the body's vital organs alive. Her oxygen levels was 88%. Normally is 95 to 100. Her blood pressure was barely sustainable. Her heart rate was erratic. She was grey. She was sweating heavily and she was barely conscious. The emergency team moved with practice urgency. With seconds of arrival, she was on supplemental oxygen. Within minutes, an IV was running. The ECG showed dramatic changes. The pattern the doctors saw suggested a massive heart attack in the front wall of the heart, the kind where a major artery has become completely blocked, cutting off all blood supply to the large section of heart muscle. The alarm code went out: acute coronary syndrome, possibly acute myocardial infarction. The protocol was clear. She needed to go to catheterization lab immediately. The goal was to open that artery before permanent damage could occur. While she was being prepared for catheterization, blood tests came back. Troponin. Troponin is a protein that is released only when heart muscle cells die. It is a smoking gun of heart injury. Maria's troponin was elevated. That confirmed it. Her heart is being damaged. An ultrasound of the heart was done very quickly. The ejection fraction, the percentage of blood the heart pumps out with each beat, was 35%. Normally is above 60%. Her heart was only ejecting 1/3 of the blood it should. It was barely functioning. Everything pointed out a catastrophic heart attack. So they rushed her to catheterization lab. A thin flexible catheter was threaded through her blood vessels from her leg, navigating towards her heart. The dye was injected so that the doctors could see the blood vessels clearly on the monitor. The cardiologist leaned towards the screen, watching carefully for the blockage, for the clot, for the narrowing that would explain this disaster. But what he saw made him pause. The arteries were completely clear, wide open, not a single blockage, not even a narrowing. The main vessels feeding her heart were precise and accurate. No obstruction whatsoever, no clots, no atherosclerosis, nothing that should cause this level of heart failure. But then the doctor looked at the shape of her heart on angiogram. The left ventricle, the heart's main pumping chamber, shows something distinctive. The tip had ballooned out and weakened. The base appeared to be contracting normally. The chamber was in unusual shape. It resembled something specific. The Japanese trap that is used to catch octopus. It's called Takotsubo. In that moment, the diagnosis shifted. This wasn't a heart attack from blocked artery. This was something entirely different, something rare, something that most doctors would encounter only a handful of times in their career. This was Takotsubo Cardiomyopathy, also known as broken heart syndrome, a stress-induced heart condition where heart becomes temporarily paralyzed by excessive stress hormones, not by a blocked artery. In a typical heart attack, the location of blockage determines which part of the heart is going to get damaged. You get a specific pattern that matches a specific blood vessel. But in Takotsubo, the wall motion abnormalities don't follow these rules. They spread across multiple territories. Maria's pattern didn't match a single blocked artery. What was happening inside Maria's body during these 5 days of stress involved multiple biological systems attacking her heart simultaneously. When her daughter delivered the news of her grandchild's cancer diagnosis, the emotional centers of her brain activated. These activated the locus coeruleus, her brain's master stress control center. The locus coeruleus is ancient from an evolutionary standpoint. It is connected to survival. When activated, it sends signals down the spinal cord to the adrenal glands, which are two small tissues that is sitting on the top of kidneys. The adrenal medulla, the inner part of these glands, then release massive amount of catecholamines. Catecholamines include epinephrine and norepinephrine. In Maria's case, the level surged 2 to 3 times higher than the normal level. These stress hormones circulated to her heart, and bound to receptors on the surface of heart muscles called beta-2 adrenergic receptors. The heart has different densities of these receptors in different locations. The tip of the heart, that is also known as the apex, has the highest concentration. This explains why the tip of the heart balloons in Takotsubo. Maria spent 5 days in the intensive care unit. The treatment approach was fundamentally different from what would have been done if she actually had an acute heart attack. Because her coronary arteries were clear, she didn't need to have an invasive intervention. It needed support while it healed itself. She received oxygen therapy to maximize the oxygen available in her tissues. IV medications were given to support her blood pressure and heart function. She was started on beta blocker medications that reduce heart's workload and block the effect of remaining circulatory catecholamines. The main treatment plan was to watchful waiting, supportive care and rest, allowing time for the toxic stress hormone to wear off and the heart to heal. And remarkably, it did. By day 2 of her hospitalization, Maria's ejection fraction had improved to 42%, and by day 6, her ejection fraction was 51%, slowly approaching to the normal. Her troponin levels, which had been elevated at the admission, peaked and then started to begin falling. This was the marker of her dying heart cells being cleared away and her body healing itself. For Maria specifically, she was discharged from the hospital after 6 days. Within 3 weeks, she was walking again. Within 6 weeks, her heart function was completely normal. The wall motion abnormalities had resolved. The ballooning at the apex had normalized and she had recovered. But here is what crucial to understand. Despite this remarkable recovery trajectory, Takotsubo cardiomyopathy is not benign. During the acute hospitalization, serious complications can occur. Research analyzing nearly 200,000 patients hospitalized with Takotsubo revealed alarming statistics. Congestive heart failure developed in 35% of patients. Atrial fibrillation, the dangerous arrhythmias, occurred in 20%. Cardiogenic shock, despite supportive care, had happened in about 7%, and stroke occurred in 5%. Maria's story teaches several critical lessons. First of all, the stress isn't just a mental health issue. The mind-body connection is real. Extreme emotional stress can trigger actual measurable life-threatening physical disease. This isn't anxiety or panic. This is biology. Secondly, postmenopausal women should be aware of this condition. If you experience sudden chest pressure, shortness of breath, palpitations, especially after an emotional stress, seek immediate emergency medical care. Don't wait. Thirdly, if you are a woman, understand that the loss of estrogen after the menopause removes a protective mechanism of your heart relayed for decades. This awareness alone can empower you to manage stress differently, to seek medical evaluation earlier, and to take preventive cardiovascular care more seriously. Maria eventually did visit her granddaughter. The child's treatment worked. He is now in remission, and Maria, carrying those memory of those terrifying 5 days, learned that heart isn't just a pump. It is connected to everything we feel, everything we fear, everything we love. And sometimes when we love too much and are frightened too deeply, we need more than just medical care. We need understanding. Thank you so much.